Dr. Michelle Fabbro is a chiropractor, acupuncture provider, and Pilates instructor. She is a health advocate with a purpose to help her patients live a healthy and pain free life. Dr. Fabbro, welcome to Elevating Women's Wellness. Thank you for being here.
Thanks, Tara, for having me.
So, tell us a little bit about yourself and how you became interested in chiropractic care.
So, first of all, I was born and raised in Sault Ste. Marie. So, growing up, I played lots of sports. I was always involved in from the elementary school level all the way up through high school. Um, from there, that's kind of where I started seeing a lot of sports injuries with myself and with teammates. So, from there, I started to learn a little bit about rehabilitation and what injury prevention is. Um, Knowing that through a younger age, it made me interested and kind of guided the profession that I was going into. While I was in school, I was looking for a career that I could take my passion for athletics and combine it with my passion for healthcare and helping people. So that's how I ended up choosing to go into chiropractic. And from there as well, it's kind of a profession where you can make your own as well. There's some people treat more traditionally and they just do like chiropractic. Other people focus more on rehabilitation. So I've really blended the two together and I've tried to make my practice my own. And I love the ability to do chiropractic, acupuncture, and Pilates all in the same day and roof under the same roof. So it's been really a really good career choice for me, I believe.
That's such a neat background that brought you to it. I played competitive sports growing up, and it's true, whether it's yourself or your teammates, like injuries tend to be rampant, but there's certainly a lot I think that we can learn about, like you said, injury prevention and then the rehabilitation piece. And I love that you pull a few different modalities into that. I think it's really valued. And like you said, too, with chiropractic care and much like other types of healthcare practices, too, you can really sort of make it your own and bring all different pieces to the table to support your patients. It's really neat how you pulled that together.
Yeah, thank you.
So, who are the typical clients that you work with in your practice?
I try to be very inclusive of all types of clients. I kind of brand myself as a family chiropractic clinic. So right now, I could have teenagers, men, women, athletes, anybody really. There's something for everybody at the clinic. Whenever somebody walks in, I do my diagnosis, my exam, and I kind of cater my plans towards their needs and their wants as well. If somebody's really excited about the Pilates, then I'll definitely give them a taste of it. If not, then we keep it to more passive care. But right now, yeah, it's an all inclusive clinic and there's something for everybody there.
Great. Thank you for sharing. And if you were to speak specifically to the female demographic that you work with, what are the types of concerns or challenges that women are walking through the door with?
There's a wide range. I have a lot of pregnancy patients, pre or postpartum. I have a lot of elderly patients who are working on mobility because as we age, we do tend to gain a bit of a forward posture. So I really work with opening up the chest, opening up through the spine so that we can have that full range of mobility through our shoulders and feel like we're standing taller and have less aches and pains.
Great. I think those are really important aims. So, what is pain exactly? It's something everyone experiences at some point to some extent, but what is it exactly, and how can we think about it differently?
So, the way I would think about pain, and the way most people probably think about it when they hear pain, is an unpleasant experience that tells you that something's probably wrong. So, from there, there's different types of pain. There's acute, which is a sudden onset of pain, or there's chronic, which has been long standing. So, pain can come on suddenly, it can come on over time, and it can feel different to everybody. There's different sensations like throbbing or aching or stabbing. But overall, the common denominator of pain is really that it's a negative experience.
Mhm.
And having that negative experience can really dampen somebody's mood and make them have a bit of a sense of loss or helplessness. So I try to take that feeling of negativity when they come into the office and try to turn it into a positive. Like, why are you experiencing this pain, and what can we do to get rid of it, to prevent it, and what can we learn from it? So how can we go forward and reduce the possibility of having this pain again? So that's where the prevention comes in. So
Mhm.
really turning pain from a negative into a learning experience potentially.
I really love that reframe of pain, that it's a learning experience. I think that's so important to think about things that way instead of like, well, this is just something ongoing and it's going to continue. Like, no, it's a learning experience because you can shift and change that, right?
Exactly.
So, what are the signs that a woman may be at risk for injury or loss of mobility?
Yeah, exactly. So kind of what I touched on before, when you start noticing everyday activities are starting to get harder. So if you're reaching up to the top shelf and you feel like my arm can't really reach anymore, it feels like it's getting stuck or impinged, or you might have a bit of a stiff achiness coming around. If you're going from sit to stand, it might feel more difficult, things like that. So, when everyday activities start to feel harder, I would say is when it's a sign that there could be a potential mobility issue or a potential injury coming in at that point.
Mhm. Which I think is important to be aware of. And at that point, what could a woman do if she's noticing that these kinds of, like she's noticing these in these examples that you mentioned?
Mhm. Yeah, so when you start to notice those, I would say it's definitely important to get ahead of it. So if you start noticing these warning signs, I'll call them,
Mhm.
always don't be afraid to reach out to a healthcare professional. You don't have to be in debilitating pain to come to the chiropractor, because we notice these signs as well, and we can give you tools to prevent a potential flare up or a potential injury that could be worse. So if you come in giving exercises and stretches and educating even just on ergonomics at home too, and to help reduce those painful
Mhm.
situations. Yeah.
Absolutely. And, I think prevention is so critically important. And we need to be talking about it more in healthcare in general. But I know that pain is generally like a driver of action for people. But you don't have to be ill or debilitated, like you said, to seek out healthcare because there's also the prevention piece. And beyond prevention, too, just optimization, health optimization. How can I feel even better yet? How can I move even better yet? Right?
Yeah, exactly.
Awesome. So I'm curious to know, in your experience, what are the common obstacles that women encounter who are healing from pain?
Yeah, so that this is a I've seen this a few times, and if people come in with the pain and they've had a few visits, they start to feel a little bit better, but then there's that fear of re-injury. I would say that is one of the biggest things that I see. They're starting to feel good, but they're afraid to go back to doing, say, they were gardening and they got injured, strained their neck. They're afraid to garden again because they don't want to have that painful sensation again. So that's definitely an obstacle, which is more of a mental fear of having that painful feeling again.
Mhm.
You don't want to get stuck in those pain patterns, like a fearful pain pattern. So I find that it's really important to, that's why I do give that prevention, or I give them at home exercises to do so that even when you're not in the office, you can feel like you're working on your injury on a daily basis and you have more control over your outcomes and your daily activities. So it really helps to give you control and the confidence to overcome that fear of injury. But I would say that that is one of the biggest post injury, post pain sensations and feelings people may have.
Mhm. So as you mentioned, it's a bit of a little bit more of like a mental obstacle and something I wanted to get into maybe a little bit further if there was the opportunity, but myths surrounding injury and re-injury, and you sort of touched on it. But I know that there can often be a fear, and I've noticed people maybe even baby an injury a little longer than they should before return to activity. What more can you say about that, like the safety of that and actually the importance of it?
Yeah, so yeah, exactly. That is kind of a myth, right? You get injured and you think it's going to affect you for the rest of your life, which isn't true. But it really depends on how you treat the injury. Because
Mhm.
if you treat the injury to eliminate pain, um, what are you doing to prevent the recurrence? So I try to look at it as I'm going to treat the cause of that pain. So, what was it that caused that pain? And then if you treat that, you should feel stronger potentially even in that joint than you ever have.
Right. So it's about the rehabilitation piece that's really important.
Mhm.
Okay, great. Thank you for shedding some light on that. I think it's important to demystify these things that can be at the root of fears and obstacles so that we can really access care and do the things that are going to make us feel the most well and get better. So, what are key elements for living an active, pain free lifestyle? What do we really need to pull into that as women?
So there's a lot of different ways to go about this. And I guess this is where I'll touch a bit on diet. So I would say the four main points to make here would be diet, exercise, rest, and then also movement.
Mhm.
Exercise and movement being different. So I'll kind of touch on that first. Exercising, I would define as like a 30-minute workout where you're just getting your heart rate up, whether that's biking or walking or jogging. Exercising has that purpose of raising the heart rate, strengthening, and kind of getting your workout in. Whereas movement is also important, and that is just everyday life. Maybe walking instead of driving somewhere, or gardening, cutting the grass, being active, and keeping up with the daily routines and being mobile after work and not just sitting on the couch for 3 hours. That's really important to keep your joints healthy, your muscles moving, and to help prevent different postural habits. And then when we touch on diet, that's always important. Eating healthy just boosts the mood, makes you feel better, and of course, everything in moderation. Enjoy
Mhm.
a glass of wine on the weekend or your Big Mac once in a while, but having a healthy diet most of the time can really boost your mood and boost your energy levels, which is very important to help with the exercise and movement piece. But then, along with the exercise and movement, you also need to incorporate rest because doing too much could also be not great for you. So, making sure you have a good balance in your lifestyle is really the key to a pain-free lifestyle.
Mhm. Yeah, and I think all those elements are important. And thank you for making the distinction between movement and exercise because there's intention behind both, but they look a little bit different, right?
Mhm.
Yeah, and I think that's important for women to keep in mind as well. So I have a question related to this as well. Why is strengthening specifically important for women? Because this is another area that I think that there's myths around, particularly if we're talking about, say, strengthening in the form of like weight training. Why is it really important for women?
Strengthening for women can be important in so many ways. I'll I talked about the prevention piece a lot. So just a little reiteration here with if you stay strong, I guess expanding on that, having that strength and that prevention, as long it also prevents injuries, but bringing in that balance component as we age, our muscles, you do have like a loss of muscle tone. So building that strength, keeping up with our strength training can help stabilize the hips, help with the core strength, and help with prevention of falls. And then
Mhm.
another piece that I haven't talked on yet is strength training is actually one of the best ways to prevent osteoporosis. Osteoporosis, as we know, usually comes on in our 40s. But what I like to say is the biggest prevention in osteoporosis is actually in our 20s or our late teens. You want to build your bank, I call it, of bone density. So, using weights, weight bearing exercise like walking, anything that will provide strength and some load on your bones is really good to help prevent future osteoporosis in women.
Yeah, so true, which I think is a really important piece to talk about because, say, for example, in my practice and maybe in yours as well, a lot of women, 50s, 60s, 70s, and beyond are then concerned about bone loss. But I don't want to say that it's too late per se, but if prevention was implemented sooner, then there would have to be less intervention down the road.
Yeah, exactly.
Yeah, so thank you so much for speaking to that. I'm also curious to just hear a little bit more, because some people might be familiar with chiropractic care. They might be less familiar with acupuncture or Pilates. And I'm so curious to hear about how you blend those three. What might that look like when you're applying it to patient care?
Sure. So I guess I always start with an initial exam, um, diagnosis, and a treatment plan. So usually my typical treatment plans, I'll say this patient is getting all three. At the next visit, I'll do a quick reassessment and then we'll start with the acupuncture. The acupuncture is useful in the way that it targets the muscles, it targets the nerves, and it really just helps to loosen tight muscles and also help neuromodulate, it's called, stimulate the nerves to talk to the muscles a little bit better. Because when there's an injury, there becomes a bit of a disconnect between the nerves connecting with the muscles and telling them what to do. So I start there with the acupuncture, loosen things up, get things a bit mobilized and modulated. And then I'll do potential soft tissue release, depending on the case, just with active release, muscle stretching. And from there, I will do some adjustments if indicated. So the typical chiropractic adjustment, where you put a force through a joint, you might hear crack or pop, not always. But that just helps release that joint. And then all the muscles around have already been loosened. So it really helps to hold that adjustment better, I find, and have a
Mhm.
longer lasting effect. And then from there, I'll go over some exercises for the patient to take home. And if they choose, I do have an option where I'll do a treatment and then also do a 30-minute Pilates one on one session with the patient. So
Mhm.
I can actually go through and cue the patient through the exercises to help with um, them understanding the movements or knowing exactly what they should be feeling at home too. So I usually use those sessions, maybe two or three with a patient for educational purposes and teaching them how to properly exercise and how to properly move. But if that, and then after, I'll definitely give them at home Pilates based rehabilitation.
Wow, that's so neat. I really love the blend of how you pull that together. I think it's unique and really important both for sort of preparing the body for adjustment and to hold the benefits of the treatment longer yet, and then the rehabilitation piece. That's so cool.
Mhm.
And then also, to be able to guide the patient, because I find, especially if people are doing at home either workouts or rehabilitation, they might not have a sense of what they should be feeling in their body and what muscles are activated at that time, or they might not be connected to muscles, or some maybe are weakened or not engaged in certain movements. So I think that's so cool that you're doing that alongside them.
Yeah, exactly. It really helps them to understand what they should feel and what is pain and what is just muscle tiredness or muscle strengthening.
Yeah, absolutely. And I have a few more questions for you. Earlier, you had mentioned that you work with women who might be pregnant or in the postnatal phase. If a woman's at either of those stages, what does she need to know specifically about exercising safely so that she can live a pain free lifestyle through that phase?
Yeah, so exercising during pregnancy is very encouraged, I want to say. Especially if you've been active before. You should always talk to your doctor and your healthcare team before engaging in activity while pregnant. But there's so many different forms. You can swim, walk, indoor cycle, yoga, Pilates. You can even do weightlifting still and high intensity interval training as well. It's really limitless, and you really have to go off how you feel and make sure that there's no negative feelings afterwards. But as long as you feel good, um, you can continue. A couple things to avoid while you exercise is quick movements, jerking or jarring exercises, because as well as deep bending and deep or large extension. You don't want to bend too far forwards or lean too far back while exercising, but as long as you keep it relatively in line and relatively within a good comfort zone, it's very recommended to keep active during pregnancy.
Great.
Uh,
I think
yeah.
that's important to know too, because so many women have a lot of questions around it, or they're fearful, or they might risk stopping activity altogether if they were previously active once they become pregnant. So I think it's important to know that it's encouraged and that there's really safe ways that you can do that.
Yeah, there are some limitations as well, which is why you should always talk to somebody first. One I will mention is after the fourth month of pregnancy, you don't want to lay fully on your back. You want to be elevated, head over baby, heart over baby. And if you have pre-existing conditions like preeclampsia or heart and lung conditions, always talk to your healthcare provider first.
Mhm.
Otherwise, relatively safe and definitely encouraged. Um, and then postnatal exercise. It really depends if you do birth naturally or through C section, the timeline to get going. But usually it's 2 weeks after pregnancy, you can start doing moderate exercise. After a C section, you want to wait to your first post op checkup to get a clearance from your doctor.
Mhm.
But again, I would say the best way to start, I'm biased, but is Pilates. Such good core strengthening and pelvic floor strengthening work there that will really help to build that core stability back up for you. Aside from that, swimming is always good, and so is walking.
Awesome. Thank you so much for that. And I think, it's important to have that understanding of having a healthcare team and checking in with people at the right time, and any cautions there. But again, that exercise movement, it's all encouraged. And I want to shift gears for a moment because, things in life can ebb and flow. How might women adapt their self care practices in times of high stress?
Okay, yeah. I f- I always kind of go with body, mind, and spirit. When you're feeling stressed out, take a step back. You don't have to go for your 5K run that you had planned that day. Always take a step back and think about what's healthy for your body, mind, and spirit that day. What'll make you feel good, feel accomplished without overstretching yourself. That's kind of how I like to look at it. Instead of going for a run, maybe do a 10 or 15-minute yoga flow just to feel good. Um, Go for a walk outside, listen to the birds, get in the wilderness. But other than that, yeah, just take a step back, get moving. You don't have to do anything crazy, but just take a step back and feel good and just lower those stress levels.
Yeah, I think that's so important to think about, and to give ourselves grace when we maybe aren't feeling at our best, or we don't have the same level of resources in a certain situation for maybe the same level of exertion. So I think it's important that to think about that. And also, I like your mind, body, spirit check in to see where you're at and to really tune in and assess that for yourself rather than some external thing like, well, it was in my calendar to do that.
Yeah, exactly. Because that can get overwhelming.
So true. So true. Now, for our final question, resilience is a topic that is so important to women's wellness, and it's also something that is near and dear to my heart. What does becoming more resilient mean to you, and how does this relate to the women that you treat?
So, resilience is something that everyone goes through and everyone experiences at some point in their life, whether they may recognize it or not. So, really, what that means is having a setback, having an obstacle come up, and working to overcome that obstacle and overcoming the stress and the suffering that goes along with it. And from resilience comes growth, um, comes strength. So I think that that's really important to note that yes, there's a setback, but getting through that setback will make you stronger in the end, and you'll be better for it most of the time. And patients coming in, um, I would say I see this all the time. And patients, maybe they don't look at it that way, but they come in and it's been a couple visits, they're feeling down, they're feeling like when is it gonna happen? When will I feel that relief, that like decrease of pain? And I see these women every day. They come in, they come to their appointments, they do their exercises, and they're putting in the work and they're working hard to overcome that limiting factor that is affecting their life. Um, yeah, I think that my goal as a healthcare practitioner is to provide the educational aspect, to provide the tools for these women so that they can take it into their own hands and they can
Mhm.
overcome these obstacles and feel a sense of confidence, feel a sense of growth and strength out of overcoming these painful things that they experience.
Amazing. I love that answer. Thank you so much, Dr. Fabbro, for being here today, for sharing your wisdom with everyone watching. I really appreciate your time.
Awesome. Thank you so much for having me.